There is a hidden truth that most seniors will never hear from their doctors, a truth buried under mountains of routine paperwork and standard protocols. Every year, millions of seniors line up for health checkups, believing they are taking every step to stay safe. But what if I told you that some of those very tests, the ones your doctor insists you need, could actually be pushing you closer to unnecessary surgery, cognitive decline, or even a devastating cancer diagnosis? New studies from institutions like the Loan Institute reveal that up to 42% of medical services provided to seniors are low value or unnecessary. This leads to a cascade of complications, lifelong side effects, and crippling anxiety. And shockingly, 99% of people over 70 have no idea they are being systematically over-tested. One of these checkups, the one we've placed at number 1 on our list, involves radiation and, according to the National Cancer Institute, is responsible for a significant number of cancers each year, a risk comparable to other well-known carcinogens. You will not hear this from your clinic. You will not see it on a primetime news report. But the truth is etched into the pages of medical science, and today we are digging it up. In this video, the 5 health checkups you should seriously question after 70, and the terrifying truth about what they can do to your body, all backed by real science. And you will not believe what made it to number 2. Before we begin, let us know in the comments below. Where are you watching from? What is your age? And do you feel that seniors are tested too much? We are reading and replying to every single comment. And don't forget to like this video and subscribe for more essential health truths. Now, let's talk about the first test. Why it looks harmless, but could quietly ruin your quality of life. Checkup number 5. The routine bone density scan. It sounds perfectly sensible. A quick, painless scan to see if your bones are at risk for fractures. You walk out with a number, a score for your skeleton. But here's the secret no one tells you. After the age of 70, a bone density scan, officially called a DEXA scan, often creates more problems than it solves. It's a test that can weaponize fear against the natural process of aging. Here's why. Bone loss is a normal, expected part of getting older, just like wrinkles or gray hair. For women especially, scans will almost always show lower density. Yet this result, often for a mild condition called osteopenia, is used to push seniors onto powerful medications like bisphosphonates. These drugs promise stronger bones, but they come with a dark side effects, like osteonecrosis of the jaw, a horrifying condition where the jawbone literally begins to die. They can also cause severe esophageal irritation and, ironically, atypical femur fractures, where the strongest bone in your body breaks under normal stress. A landmark study in the Journal of the American Geriatric Society found that for women over 70 with mild bone loss, these medications reduced fracture risk by a minuscule 0.3% over 5 years. The risk of suffering from medication side effects, however, was far greater. Consider Rose, a 76-year-old retired piano teacher. No falls, no pain, active daily life. Her DEXA scan showed mild osteopenia. Her doctor immediately prescribed a bisphosphonate. Within 3 months, she developed such severe acid reflux and jaw pain, she couldn't sleep, let alone play piano. The better option? A 2022 study in Osteoporosis International proved that lifestyle changes, like targeted strength training, balance exercises, and ensuring adequate vitamin D and calcium from food, can reduce fracture risk by over 20%. Don't let a number on a screen scare you into a treatment you may not need. But there's one scan that can lead to something even scarier: brain surgery. Let's talk about that next. Checkup number 4. A brain MRI for mild forgetfulness. When an older person starts misplacing keys or forgetting names, the immediate fear is dementia. In response, doctors often order a brain MRI to get a look inside. But here is the uncomfortable truth. For mild, age-related memory complaints, an MRI is like taking a satellite photo of Earth to find a lost wallet. It shows you a lot, but almost none of it is helpful, and it often finds things that only cause more panic. MRIs in people over 70 will almost always show age-related changes, things like slight brain shrinkage or white matter spots. These are the brain's equivalent of wrinkles. But once a radiologist writes abnormality on a report, a terrifying cascade begins. A 2021 study in Neurology Today reviewed over 3,000 MRI scans in seniors with mild cognitive complaints. A staggering 86% showed some form of abnormality, but only 3% of those findings were linked to an actual, treatable condition. This means the vast majority of people were subjected to the emotional terror of being told something is wrong with your brain, when in reality, it was just normal aging. Worse, nearly 12% were sent for invasive follow-up procedures like spinal taps or even brain biopsies, all based on these vague, incidental findings. Unless there are red flag neurological symptoms like seizures, sudden personality changes, paralysis, or a rapid, dramatic decline in function, a brain MRI is rarely the right first step. A better tool is a simple, paper-based cognitive screening test, which can effectively evaluate memory and thinking without the risk of false alarms and unnecessary panic. Now brace yourself. The next test is one you've probably had multiple times, and it's number 3 for a reason. Checkup number 3. The routine cardiac stress test. It's one of the most common tests for seniors who mention feeling a bit more tired or having vague chest tightness. The cardiac stress test, where your heart is monitored while you exert yourself, is designed to spot blocked arteries. But after 70, especially for patients without clear signs of heart disease, this test becomes dangerously unreliable. It can trigger a domino effect of false alarms and invasive, high-risk heart procedures. The problem is its accuracy. Studies show that in adults over 70, the false positive rate, meaning the test says there's a problem when there isn't, can be as high as 40%. This often leads directly to an angiogram, where a catheter is threaded into your heart. And if even a mild, stable blockage is found, the pressure to place a stent can be immense. A major 2017 study in JAMA Cardiology found that more than half of all stents placed after these routine stress test referrals were done in patients who had no major symptoms and received no survival benefit from the procedure. What they did get were higher rates of bleeding, kidney damage from the contrast dye, and prolonged, traumatic hospital stays. A better option for low-risk individuals is often a simple resting EKG or a coronary calcium scan, a low-radiation CT scan that accurately measures the amount of hardened plaque in your arteries. It's safer, more direct, and far less likely to push you onto a surgeon's table for a procedure you never needed. Checkup number 2. The routine colonoscopy after 75. You did not expect this one. The colonoscopy is hailed as a life-saving hero of cancer screening, and for people age 45 to 70, it absolutely can be. But after age 75, the equation changes dramatically. The official guidelines from the U.S. Preventive Services Task Force state that routine screening for colorectal cancer is not recommended for adults over 75 who have had consistently negative past screenings. Why? Because the risks begin to outweigh the benefits. The preparation is brutal, involving powerful laxatives that can cause severe dehydration, electrolyte imbalances, and acute kidney injury in older adults. The sedation itself poses a greater risk of confusion, falls, and breathing problems. Most critically, the procedure itself becomes more dangerous. The risk of perforating the colon, tearing a hole in it, is significantly higher in older, thinner intestinal walls. This is a life-threatening emergency requiring major surgery. Studies published in JAMA Internal Medicine show that for a healthy 75-year-old, it would take screening hundreds of people to prevent a single death from colon cancer. Meanwhile, the rate of serious complications from the procedure itself rises sharply. The benefit is small, but the potential harm is immediate and catastrophic. If you are over 75 and have a history of negative colonoscopies, or have no symptoms like rectal bleeding or unexplained weight loss, having just one more is a decision that requires a very serious conversation with your doctor about the real, tangible risks. Checkup number 1. The full-body CT scan. This is the one. The test marketed to anxious, wealthy individuals as the ultimate proactive health measure. A full-body CT scan promises to find cancer, heart disease, or aneurysms before you even have a symptom. But what it delivers is a massive dose of radiation and a near certainty of finding something that will lead to a spiral of fear and unnecessary procedures. Let's talk about radiation. A single full-body CT scan can expose you to a radiation dose equivalent to 500 standard chest X-rays. The National Cancer Institute estimates that this level of radiation exposure carries a tangible risk of inducing a future cancer. But the more immediate danger is the problem of incidentalomas, harmless, benign abnormalities that these hypersensitive scans are guaranteed to find. A spot on the liver, a nodule on the lung, a cyst on the kidney. Over 90% of these findings in asymptomatic people are benign. But once it's on a report, no doctor can ignore it. You will be sent for more scans, more radiation, and often a needle biopsy. This is where a long needle is inserted into your body, your lung, your liver, your kidney, to take a tissue sample. These biopsies carry risks of bleeding, infection, and in the case of the lung, collapse. You are put through weeks of terror, waiting for results on a spot that was never going to harm you in the first place. The American College of Radiology has issued strong recommendations against using full-body CT scans for screening asymptomatic individuals precisely because the risk of harm from follow-up tests far outweighs any potential benefit. It is the ultimate example of over-testing, a high-cost, high-risk procedure that preys on fear and almost always causes more harm than good. Your body is not a machine to be scanned for defects. It is a living system. And after 70, wisdom isn't about finding every tiny flaw. It's about protecting your quality of life from the very real dangers of medical overreach. So what is the takeaway from all of this? The message is not to fear medicine or to avoid your doctor. The true takeaway is that after the age of 70, your health is no longer a simple checklist. It is a nuanced landscape where wisdom must guide every decision. The greatest danger is not a specific test, but the unthinking, routine application of it. It's the one-size-fits-all approach that fails to see you as an individual. This knowledge is your shield. It is your tool to transform your relationship with the medical system from one of passive acceptance to one of active partnership. You now have the power to ask the most important questions. Doctor, given my age and my overall health, do the benefits of this test truly outweigh the risks? What will we do differently if this test is positive? And what if it's negative? Is there a less invasive alternative we can consider first? True health in your later years is not about chasing every shadow on a scan. It is about preserving your quality of life, your peace of mind, and your dignity. It is about making informed choices that protect you not just from disease, but from the harm of unnecessary intervention. You are the foremost expert on your own body. Trust your instincts and demand to be a partner in your own care. We have a question for you. Which of these 5 tests surprised you the most? Was it the colonoscopy or the hidden dangers of the brain MRI? Share your thoughts in the comments section below. Your story matters, and it helps others in this community feel less alone. If you believe this information is vital and could protect a friend or a family member, please give this video a like so that this message can reach more people who need to hear it. And to ensure you never miss another video where we uncover the hidden truths of modern health, make sure you subscribe to our channel and click the notification bell. Thank you for watching, stay informed, and be well.